So, welcome to our show, Wellness Bites with Gauri. And today I'm very excited to have one of my very close friends and a really well established and really very well known endocrinologist right here in Dallas Fort Worth, Dr. Madhuri Devdhar. She is an epitome of specialization, of education, and lot of expertise. And I'm really excited to have her on my show today because we are going to talk a really very important topic, which is PCOS and hypothyroidism. So, Madhuri, welcome to our show today.
Thank you, Gauri. Thank you for having me on your show. Truly appreciate that.
Okay.
I'm very happy to be here.
Wonderful, wonderful, Madhuri. So, Dr. Madhuri Devdhar is not only a board certified endocrinologist, but she also has board certification in internal medicine. She also has a lot of research publications under her belt, a lot of research abstracts under her belt. Two fun facts I came to know about Dr. Madhuri Devdhar also is that she's trained in Carnatic music,
Mhm.
and she also has a bachelor's in Sanskrit, the ancient
Mhm.
Indian language. So that is absolutely wonderful, Madhuri.
Mm. Thank you. Thank you, Gauri.
So, Madhuri, tell me more about yourself. How did you come into this field, and what makes Dr. Madhuri Devdhar unique?
Okay. Well, so let me start with a little bit of background about me. I went to medical school back in India, Bangalore. I graduated from Bangalore Medical College.
Hmm.
And then I came to the States and I did my residency in internal medicine at Washington Hospital Center, Georgetown University Hospital, Washington, D.C. And then I did my fellowship in endocrinology, diabetes, and metabolism at Georgetown University Hospital, Washington, D.C. as well. Then, as a family, we decided to move to Texas, and we moved to Texas in 2014. And I have been with Endocrine Associates of Midcities since then. Our practice is in Bedford, Texas. And Bedford, as most of you know, is the city right in between Dallas and Fort Worth.
So wonderful, Dr. Madhuri Devdhar. Absolutely great. It's just wonderful to know, so much of, so much of expertise and so much of experience you have. Now, one other thing that comes to my mind, since we are going to talk more about PCOS and hypothyroidism, the question that comes to my mind is, what is PCOS and what causes PCOS?
So PCOS is the short form of or abbreviation for polycystic ovarian syndrome. And this is a kind of disorder which we see in women where it is characterized by three important things which are in the definition of PCOS. The first one being irregular menstrual periods. So all of us women, we know that we are supposed to have more or less one period every month, so about 10 to 12 periods a year. But if any of us, if one has menstrual periods which are very irregular and spaced out, say they're getting it once every couple of months, once every 3 months, once every year, or none at all in a couple of years, all of this could be PCOS. So if it's irregular menstrual periods, and if one is not pregnant, we do think of polycystic ovarian syndromes as one of the differential diagnoses. Now, the other two things that go into the diagnosis or definition of polycystic ovarian syndrome are elevated testosterone level in women. Now, you might think, well, testosterone is a male hormone. Why are we talking about this in women? So the way the one above the Lord made us is that all of these women have a very, very low dose of testosterone, and all men on the other side have a very low dose of the female hormone, which is the estradiol. So God has given a little bit of both of the male hormone to the woman and a little bit of the female hormone to the man. Now, in women, though, the male hormone is about I would say about 1/50th to 1/100th of what men have. So it's a very small amount, very, very small amount, but that's all we women need. And even if there is a slight increase in this hormone, nothing close to male hormone levels, but even if there's a slight increase in the male hormone or testosterone levels in women, it can cause irregular menstrual periods and polycystic ovarian syndrome. At the same time, we can have a measured, slightly elevated testosterone in in women with polycystic ovarian syndrome, or we can also have features of elevated male hormone or testosterone level in women, which include increased hair growth around the lips, on the face, on the chin, on the chest, back, bottom, or even increased acne in women who are much older, whom you would not expect to have acne. So the three most important things in polycystic ovarian syndrome are presence of irregular periods, elevated testosterone level in women, and you have to understand that this could be a very minute increase, and then features of elevated testosterone level in women, which could include increased hair growth and severe acne in women, in non-adolescent women. And sometimes, very rarely, we could see hoarseness of voice and stuff, but those are not common. Now, so we need to have at least two of these three, but the most important would be irregular periods. Now, there is also a conception or a perception that most women with polycystic ovarian syndrome have a lot of cysts on their ovaries. Mostly that's the case, but even if they don't have polycysts on their ovaries, it's still considered polycystic ovarian syndrome if it meets the other criteria that I just described.
So that's very interesting to know that, Dr. Devdhar, the way you explained about PCOS and explained about especially the male hormone and the role it might play in things as well. Let's also talk about hypothyroidism. So what is hypothyroidism and what can cause hypothyroidism?
So hypothyroidism, so let me start by saying a little bit about my very beloved thyroid hormone. It's extremely important for our body. It's made in a gland. The thyroid hormone is produced in a gland called the thyroid gland, which is actually right here. It's a butterfly-shaped gland right in the bottom of the front of the neck, or the base of the front of the neck. It's a very small organ, but it's so important because it controls the metabolism of the body. Extremely important for survival. Now, hypothyroidism means if there is any dysfunction of this thyroid gland, it can produce less than optimal thyroid hormone levels. And when the thyroid hormone levels are lower than what they need to be, that is the condition which is described as hypothyroidism. Now, if we go into the causes of hypothyroidism, there are many, many causes of hypothyroidism, but I would like to stress a few here today. The first and the most common cause of hypothyroidism that we see is an autoimmune disease called Hashimoto's thyroiditis. This is just the name of the scientist or the doctor who described it, Dr. Hashimoto, where there is actually antibodies produced in the blood in our body. And these thyroid antibodies interact with the thyroid cells and make them less active. So that even the thyroid cells become less active, there can be less production of thyroid hormone, causing hypothyroidism. Now, this usually runs in families. The thyroid antibodies usually runs in families, and it's more common in the women lineage of the families than the men. And then it can still, skip generations. Families mother to daughter, daughter to granddaughter, or son, may have the thyroid antibodies, but not everybody in the family needs to be hypothyroid. Only about 20% of the people who really carry the thyroid antibodies are truly hypothyroid or have low thyroid levels. The other people in the same family could still be carrying the antibodies and still be, their thyroid can still be functioning fairly normally. Now, I would also like to, there are other causes of hypothyroidism. And a couple of them are when we surgically remove the thyroid for any reason. It could be a very big thyroid nodule, or what we call as goiter, which is causing difficulty breathing, swallowing, hoarseness of voice. We take the thyroid out. So when one does not have a thyroid gland, then they will have hypothyroidism. There is also rarely injuries, thyroid cancers, lymphomas of the thyroid, where the thyroid has to be removed, can cause hypothyroidism. And there's also a very, very rare cause of hypothyroidism called congenital hypothyroidism, where a baby is born without a very good functioning thyroid. And for this baby to survive, it needs to be given thyroid hormone right away. So these are some of the most common causes of hypothyroidism. But like I stressed, the very important one is the autoimmune hypothyroidism, or Hashimoto's thyroiditis, which we see very commonly.
So very interesting, Dr. Devdhar, regarding the way you explained about hypothyroidism and the different causes of hypothyroidism as well. Other question that comes to my mind is, are PCOS and is hypothyroidism related? Is it possible for a woman to have both of these conditions present at the same time?
Right. So polycystic ovarian syndrome and hypothyroidism can coexist in the same woman. And we see that, I would not say quite a bit, but here and there. But they are not two related conditions. Again, polycystic ovarian syndrome as well as hypothyroidism are both hormonal conditions, but hypothyroidism is a condition which affects the thyroid hormone, and polycystic ovarian syndrome is a condition which affects the female-male hormone balance in a woman's body. So both of these are hormonal disorders, but they are not necessarily related. They can coexist, they may not coexist.
So that is very interesting to look at that aspect as well. The other question I have is, I know that PCOS we see in women, but when it comes to hypothyroidism, is this something that is most commonly seen in women as well, or do we see the hypothyroidism in men as well? And why do we see more of that, especially the hypothyroidism in women?
Polycystic ovarian syndrome obviously is a female disorder. Hypothyroidism as well is more of a female disorder. There is a female predominance over males. And this is because of the way the antibodies are transmitted in families, and plus they are expressed more in the women. And also we do see that, just having the antibodies, like I told you before, does not make one hypothyroid. There could be a second insult, which is more common in women, pregnancies, deliveries, lactation, or anything else, that is, that could actually make the hypothyroidism come to light or be diagnosed. So those are some of the factors that we see that makes hypothyroidism more common in women than in men.
So that's very interesting to know about that as well. One of the things that also I wanted to ask you is, what things can actually help manage PCOS, and what things can actually help manage hypothyroidism?
Okay. So let me talk about polycystic ovarian syndrome first. Polycystic ovarian syndrome is seen more in women who are overweight or tend to gain a lot more weight. That's exactly when the male-female hormone balance goes a little bit haywire. It doesn't have to be a whole lot, just a little bit haywire, which can cause polycystic ovarian syndrome. Now, like we talked about, irregular menstrual periods, increased hair growth, acne are very classic symptoms of polycystic ovarian syndrome. And there is also one very important branch of polycystic ovarian syndrome where there could be insulin resistance and predisposition to diabetes. And we all know that the risks involved with diabetes, especially if we have it from younger age, like a lot of these polycystic ovarian syndrome women do. So it's extremely important to manage polycystic ovarian syndrome and diagnose first and then treat it effectively. And the most effective way of treating polycystic ovarian syndrome is to get on a good diet and exercise regimen and, slowly and steadily lose that weight. It definitely alters the female-male hormone balance then, and all of these symptoms start getting better and better. The other very common sign that I see in polycystic ovarian syndrome is darkening of the skin in the flexor areas. And by flexor areas, I mean the neck, the underarms, the inguinal skin, all that gets darkened because of the insulin resistance and loss of weight. You can easily see that this darkening gets better and better. So extremely important is a good diet and exercise regimen. It is hard for any of us to lose weight, and who knows it better than you and me, because we as our job. But polycystic ovarian syndrome women, it's even more difficult for them to lose the weight. The equation is, what the equation is for weight loss, how much we put in versus how much we put out, intake versus in terms of calories as out versus output in terms of calories with exercise. If it's a net negative, we tend to lose weight. And if it's a net positive, we gain weight. With the polycystic ovarian syndrome women as well, I tell them, the equation still stays the same, but it's just a little bit harder for them. And but so we all fall through the cracks, getting up and doing the right thing, a good diet and exercise regimen, and even a 3 to 5% weight loss, loss of body weight is going to make a significant impact in these women with regulating their periods, improving their insulin resistance, getting rid of the skin darkening, getting rid of excess facial hair and, acne and stuff. The other medication-wise, we treat these women with metformin because it helps with insulin resistance and with regulating the periods. We also treat these women with birth control pills if they are not desirous of a pregnancy. So that helps bring back their periods. Menstrual periods are almost like the heart rate and pulse and blood pressure. We call it another fifth vital sign in women, because if they're not regular, then that's not normal. So we really, really want to regulate them, because they may not realize it now, but long term, they will have a lot of complications, including severe osteoporosis and, predisposition to fractures. So we want to regulate the periods. We want them to lose weight. Metformin. We use metformin, and I sometimes also tend to use some weight loss medications and have them on a good weight loss program, especially when they hit a block, when they're doing their best with diet and exercise, but just need a little bit of a push. So we temporarily use some weight loss medications. In women who are desirous of pregnancy, I do see that just losing that even the 5 to 8% of body weight, just because it makes them so much more fertile and, regulates their periods, they start ovulating again. It's just amazing. We don't have to do anything much other than giving them metformin, but we do use some other medications like Clomid and stuff to regulate, to help them ovulate as well in women who are desirous of pregnancy. So that's how we manage polycystic ovarian syndrome in a nutshell.
Wonderful. I mean, I love the way, talked about how you managed talked about PCOS and how to manage, PCOS and things. But what about hypothyroidism? Can you stress a little more about hypothyroidism?
Sure. Hypothyroidism is so common, and I see a lot of women with these symptoms, fatigue, weight gain. feeling cold all the time, dry skin, hair loss, constipation, and hypothyroidism actually can cause excessive menstrual bleeding as well if it's very severe.
Hmm.
And if it's very severe, it can cause depression as well. So these are the symptoms we see quite commonly in patients with hypothyroidism. And but I would like to stress one thing here,
Hmm.
that these are very vague symptoms. And these could be coming from hypothyroidism, but they could be coming from a bunch of other things. It could be infections, just depression by itself, being stressed out, overworked, which we all are in this
Hmm.
modern city life, urban life, city life. And so it may not always be hypothyroidism, but when it is truly hypothyroidism, we check their levels. And if they're on the low side, we treat
Hmm.
them with thyroid hormone. There's two different kinds of thyroid hormone. One is T3 and one is T4. Now, T4 is the most important one. It's the most stable one.
Hmm.
And that's why we always treat them with T4 thyroid hormone. And sometimes when they need a little bit of T3, we do give them T3. But every cell in the body has the mechanism to convert T4 to T3 if it needs it that way. And so T3 is not extremely important. It's the T4 that is more stable, and that's how we regulate their levels. We try to optimize the dose of the thyroid hormone,
Hmm.
and by doing regular blood checks, and then that helps a lot of their symptoms.
Perfect. I mean, so very well described, Dr. Devdhar. Since we're talking about PCOS as well, the other question that comes to my mind is PCOS and pregnancy. What is the relationship? And can women with PCOS get pregnant?
Right. Oh, yeah, yeah. It's a wonderful question, Gauri, because a lot of women with PCOS are under the impression that they can never get pregnant.
Hmm.
And that's absolutely not the case, because they don't have regular periods, they're not ovulating, they think they can never get pregnant, and that's not the case. Like I just explained a little while ago, a good diet, exercise regimen, even losing about 5 to 8% of body weight, going on metformin, doing all the right things. I do see a lot of women get pregnant naturally, even with PCOS. Of course, when they start, they do have something called subfertility, is what we call it, and not infertility. Infertility is the inability to get pregnant, and subfertility is where there is, slightly reduced fertility, but not the inability to get pregnant. So we never call it infertility, we call it subfertility with this. But with all these measures and management that we just talked about, these women can get pregnant, have healthy children, have healthy pregnancies, and do extremely well. These women are predisposed to diabetes, like I say. So
Hmm.
it's going to, it's a lifelong thing that they need to be on a good diet and exercise regimen, which will help them extremely. But so do all of us. So do all of us. They have to be more careful, but so do all of us in general do need to be on a good diet and exercise regimen anyway. But the PCOS patients just need to be a little bit more careful about this.
Absolutely, absolutely, Dr. Devdhar. I can definitely agree on that. And I mean, just to think about, just 5 to 10% weight loss overall can make such a lot of difference, especially with women with PCOS as well, and also can make a difference for women with hypothyroidism as well. So then, when women or a patient with, let's say, PCOS or hypothyroidism walks into your clinic, or how can you help a patient with PCOS and hypothyroidism?
So when a woman with polycystic ovarian syndrome walks into my clinic, sometimes they know that they have it. Many times they don't. So I ask them all the right questions. We diagnose them, and make sure we start giving a lot of education about this. Like I talked about, there's a lot of aspects of PCOS, irregular periods, how it affects them at that point, if they want to get pregnant, if they don't want to get pregnant, and long term, how these irregular periods will affect their body, their bones. It can cause osteoporosis, and how even increased hair growth, increased acne. These are young women.
Mm.
They it's it's, you know how it's in the society, it's a stigma. So we talk about that and how we can make this better. And we talk about the predisposition to diabetes. We talk about the darkening of the skin. And we also talk about the fact that they can definitely get pregnant. And based on their personal situation, one size or one treatment does not fit all. And they come in all different, with all different symptoms and signs. Based on this person's situation, we come up with a customized plan for them and work with them.
Absolutely great, Dr. Devdhar. I absolutely loved that, one, you emphasize a lot on education. Second thing, that you personalize, the plan for every patient that walks into that. Absolutely wonderful. So what wellness tips would you like to share with the audience today?
Yeah, so, there was a question about, you asked me this question initially, like, why did I end up in the medical field and why did I
Correct.
in endocrinology? So I'll stress a little bit here because it's kind of related to wellness. And, I always wanted to be a doctor, but, and when I went to medical school, I was just, I thought that the endocrinology and the way the hormones work together and in parallel with each other was just mind-boggling. With different feedback mechanisms. So, out of all the specialties of medicine, I truly myself chose endocrinology and went into my fellowship, and I just loved every minute of it. And I really, really love what I'm doing. And if you ask my patients, it kind of shows, because I do it from my heart. I like helping people. I like to see that they're so much better. And, if a PCOS patient or a hypothyroid patient comes and thanks me, or any other patient for that matter, later on, that, they feel better or they were able to achieve whatever their objective was, and that's just so fulfilling. So that's something that I just want to share with all of you. And I'm sorry, I totally forgot the question. Oh, the wellness tips. Yes.
Yes.
Yes. So, like I said, one size does not fit all, but one thing that does fit all is a good diet and exercise regimen. Lots of green leafy vegetables, lean meat for meat eaters, stay away from all the good carbs, in the sense, all the good foods, all the good junk foods that we like, including, pasta, pizza, sodas, desserts, white rice, noodles, you name it, all of these, it's not that we have to completely stay away from them. You are a dietitian, you know it yourself, but limited portions, that's the key. Portion control is the key, for all this, we are all human. We want to be able to eat and enjoy, but, limited portions is the key. And then, exercise. I cannot stress it enough. We all need to give at least 30 minutes of brisk exercise. And I stress that it should be cardio every single day. And if we want to do some weight training, body strengthening, be my guest. It's a great thing, but at least 30 minutes of cardio, brisk exercise every single day, which raises up your heart rate. Those are the fitness suggestions that I would like to share with all of you.
Absolutely great tips and suggestions you gave, Dr. Devdhar. Definitely, you emphasized on the diet and being active. Wonderful suggestions, absolutely. Coming to your own personal health and wellness routine, is there a particular health and wellness routine you follow?
I really try to stick to about 10 to 15,000 steps a day. More or less 2,000 steps every day is 2,000 steps is 1 mile. So if I can get 10 to 15,000 steps a day, that's about 5 to 7 miles a day, which is good enough in our stressful life. We got to wear different hats these days, do a lot of different things, and I totally understand that, and most of you all are doing the same thing. So 10 to 15,000 steps every single day, the consistency is the key. It's not 2 days a week of exercise or something. So I usually try and get out for an hour's walk every single day if I can do it. Yeah, and that really gives me sanity. That really, I try to go out and walk if I can. And if since the gyms are all closed now with COVID, if not, I just use my treadmill at home. As far as diet is concerned, I drink lots and lots of water, and I truly believe in intermittent fasting, where you really stick to eating about 6 to 8 hours a day. Again, controlled portions, all good stuff, balanced diet. It's not like you should not, definitely not eat this or not eat that. All good stuff, but in controlled portions. I think intermittent fasting, I really like it because, it's not 3 spread out meals in a day and 2, 3 snacks, it's kind of compressed, and, the rest that the body gets for about 16 hours a day, that really helps improve your insulin resistance and makes you more insulin sensitive, which is a big deal.
Wonderful, wonderful, Dr. Devdhar. I mean, I love the way that you talked about, and especially that you talked about, being active and how you are active as well. And you talked a little about the intermittent fasting as well. Is there any update or any event and things you want to share regarding your practice, or any event you want to that's coming up that you want to share with the audience today?
We do have events in our office here and there, but we don't have one currently. But if there's something that comes up, we'll definitely let you know. And you have been involved with some of the events in our office before, so we'll keep you posted. But right now we don't have any particular events, but we do have, seminars and conferences on diet, diabetic diet, different kinds of diet and stuff, as you very well know. And as one comes up, we'll definitely keep you posted.
Wonderful, absolutely. And I would love to share that as well when you share those that information and those links and things. I would love to share that with our audience as well.
Absolutely.
So how can people contact you, Dr. Devdhar?
So our office, like I said, is right across from Texas Health HEB Hospital in Bedford, Texas. And our office phone number is 817-786-8686. Again, it's 817-786-8686. And please feel free to call our office and make an appointment if you would like to be seen for any of these hormonal disorders. We also treat diabetes, growth hormone problems, pituitary disorders, testosterone issues, parathyroid hormone levels, calcium, vitamin D deficiency, calcium metabolism. We do prolactin issues, lactating issues. We do a lot of these. So, please feel free to call us if you would like to see us for any of these.
Wonderful. That's absolutely great, Dr. Devdhar. And it was such an pleasure to talk to you and, about PCOS, hypothyroidism. It was such a great discussion. And thank you so much for coming on our show today. It was a wealth of information that you shared with the audience today. So thank you so much for coming on our show today.
Thank you, Gauri. I really enjoyed talking to you today. And thanks a lot for having me on your show. Truly appreciate it.
Absolutely, absolutely. So to all the audience out there, make sure to like our episodes, share episodes. These episodes are available as podcasts on our website, www.ayurnutrition.com/podcast. These are also available on Amazon Music, on Google Podcasts, as well as Apple Podcasts, Spotify, and much more. You can also listen to these podcast episodes on some of your smart listening devices as well. These episodes will also be telecasted on our YouTube channel. So again, make sure that you subscribe to our YouTube channel as well, which is AyurNutrition. So again, thanks a lot for listening to our episode and have a wonderful day. Thanks a lot. Bye-bye.